Welcome to the tutorial Learning by Example. This case study is an abbreviated view of one of the case studies you will find more fully examined in the book, The Children's Medication Toolbox. This example was chosen for the tutorial because it demonstrates how the system reports information in a case where there was a positive treatment response and no significant complications. The software program includes data from 4 sample cases described in the book, in which the treatment response of actual children is analyzed and summarized to illustrate how to assess and use the information. Identities have been protected and complex case samples are included. Medications referenced in examples will be referred to in terms of the class of medications they represent. This is done to reduce any tendency to over-identify with the sample elements that may cause some readers to attribute characteristics of a specific medicine to an outcome described positively or negatively. Outcomes described may or may not apply in a reader's case. This is an example of a 9-year-old girl's 16 observations occurring over approximately 1.5 years of treatment for depression and anxiety, with this summary being at her age 11. When first seen, this child had begun refusing to go to sleep except with her mother. She had frequent stomach aches, headaches, and other physical complaints. Raging, explosive, and argumentative behaviors were increasingly impairing her academic, social, and familial relationships and attitudes. She was anxious and neurotic, wetting the bed each night and increasingly resisting school. Her father felt the mother was enabling some of her difficulties, and the mother felt the father's strict approaches were ineffective. Both felt her behaviors were worsening and having negative impact. Psychological and medical evaluations were completed, and a treatment trial with a tricyclic antidepressant was initiated. The book provides greater detail regarding this and the other teaching examples of treatment monitoring and management and understanding of medication effects and children's treatment response. This is the initial circumstances report. Although the focus of the primary concern in this case was bedwetting, the high percentage of observed symptoms show a more complete view of how her interactions with others, developing traits and self-perceptions were expressed. The frequency of observations is flexible and depends on the circumstance. This case began with an observation that preceded the medication trial. The medication was effective and a planned dosage adjustment occurred. Observation comments and characteristics helped to determine the dosage, and those are discussed further in the book. In this observation, the child has received the medication for 7 days and improvements are beginning to be seen. In addition to the medication, behavioral expectations and consequences were reconsidered, agreed upon, and incorporated by the parents, and the child began receiving psychotherapy and treatment monitoring. The program's medication manager shows when the initial dose was discontinued and replaced by an increased dose. These are the primary observer's comments at the second observation 7 days after starting the medication. Jenny started the medication on Tuesday night. She has been dry at night and has had no accidents for 5 nights in a row, which she is excited about. She still gets angry and emotional over things, and over the weekend seemed to actually be more emotional than usual. She cried and got upset over very small things. An example was at a relative's home. She got upset and off and out of the room and was crying and wanted to go home. Can the medication have that effect until it starts to become fully effective? Her father thinks she has been easier to reason with. We see some differences in her, but this weekend I thought was off because how upset she got and emotional. I have noticed at night she seems to fall asleep faster and her cheeks are red. And if you try to wake her up, she seems out of it. Could this also be from the medicine? When reviewing several months or more of treatment, it is very helpful to see your earlier comments. For many, it is an opportunity to see how far they have come and place current concern in perspective. The predefined items make up the 6 scales that were introduced in our other tutorials. This graph reflects the child's positive and sustained response to treatment. That doesn't mean there weren't behavioral or other challenges or issues to be dealt with during the process. There were, and those in the other case examples are discussed further in the companion book. Thank you for watching this tutorial. We encourage you to watch our other tutorials and hope you find them helpful.